I really wanted to start a consumer program at WEHI to give other researchers the same opportunities that I had to have patient contact. I would come back from my breast cancer clinic every week and have stories to tell that really drove me in what we were doing.
It really grounds me and it adds purpose to my research.
It enables us to focus on the bigger picture.
I was admitted to emergency. These people had basically saved my life, and I would do something in some form of paying back.
The consumer program's aim is to put the patient voice front and centre of medical research. It's almost like bringing the patient or the families into the lab and creating reality for a researcher who may have never normally met a person with the disease. It's up to the individuals, the consumers and the researchers, to get to know each other and build a relationship that's organic and happens over time.
I wanted to sort of help put a human face on the disease.
I see my consumers as friends, and I always look forward to seeing them.
You meet such a breadth of people in the meetings, people that I would never think would be interested to speak to me, that you have first-hand relationships with, and they treat you so respectfully.
The WEHI Consumer Program, I think, has success because of its flexibility.
Consumers are incredibly supported within our program. Being able to jump online from the comfort of their own home has enabled interstate consumers and rural consumers to participate in the program more.
Travelling is sometimes difficult. You can be at home, you don't need to have to think about the travel, and so there's always the opportunity to have what we call a hybrid meeting. We also record meetings so that there's always the opportunity to catch up.
I work full-time, I have a young family, have other commitments outside of work. The program is very flexible. For the consumer, you can get as much or as little as you want out of the program within your schedule.
It actually makes it more accessible for people like me who do live interstate. We have built up a valuable relationship just doing it online.
It's not a one-way conversation. The researcher explains the science and the consumer adds value from a community perspective. It is the role of the researcher to be able to break that science down in a lay language so that you can understand it in a step-by-step process.
We've established a glossary, which means you build up an understanding.
You do not have to have an in-depth understanding of science. If you are a person with a medical condition and curious about science and the research, you are qualified.
Everyone is able to understand science, and the point of this program is to be able to break it down into bite-sized pieces so that anyone from any background is able to participate.
You often get matched with researchers who are also from all over the world. For some of them, English might be a second language. We need more consumers from different backgrounds with different diseases and different needs.
I think it's very important to hear those perspectives from different minority communities, particularly people who are gender diverse, sexually diverse. As researchers, we're interested in your diverse perspectives, and so I encourage you to reach out to the Consumer Program Manager.
I've met very powerful consumers who have the potential to really shift the dial at the government level, corporate, pharma.
Not only do they help in bringing the patient perspective, but they also provide a sort of a different ways of helping us thinking about our research questions, how we write our grants.
I'm learning to communicate much more effectively with not only other researchers, but also lay people.
By sitting patients, researchers, clinicians and family members at a table and having open discussions, we're going to come up with great, big, brilliant ideas. The consumer voice is so important because at the end of the day, this is why we're doing medical research, to benefit the community.
It's something that I can do to make a difference. It gives me hope also. And you never would have believed as a patient that you would be getting to speak to people so involved at the cutting edge of research that actually are interested in your perspective. It's just been really exciting.
I would recommend for people to join the consumer program at WEHI for 3 reasons. Firstly, the fantastic education program. Secondly, the support from the consumer program team. It is absolutely exceptional. And thirdly, just the culture at WEHI, the culture of collaboration, of learning, that quest for new knowledge, and just, you know, the general ambience and feel of the place. It's a great place to work with.
It enlightens you. It's a great cause, supporting these people. They don't get the headlines that they deserve. By coming in and supporting them, you in a small way are adding to their research and to their importance and value in our community.
It is enriching to me intellectually, but also mentally as well.
It feels like a friendship.
I think it's worth every moment.
Talking to consumers really bring back the perspective of why you're doing this work.